I qualified when I was 21, so nursing's kind of all I've ever done, really. I spent the majority of my time within the A&E departments across the Northwest. And then I decided that NHS wasn't really for me anymore. I didn't quite like the way it was going. I couldn't nurse people anymore. I couldn't look after people the way I wanted to look after them. It just kind of lost what nursing meant for me. Hiya, Sandra. Good morning. Are you okay?
I'm okay, how are you?
Good, yeah, I'm good, thank you.
You had a good week?
Yeah, not bad at all, actually. Have you?
Because I've been up hours, actually.
Have you?
Well, yeah.
Right.
What have you been like, Sam?
Same, yeah. Yeah, once the birds start and the
Yeah.
sun's shining through the curtains. So what have you got for me to do this week? What would you like me?
Just them right tiny bit of ironing.
Yeah.
You can wipe the units if you want in the kitchen.
Okay. I love just interaction. I love patient interaction. And I love seeing people get better. I mean, that's really the nature of why I came into nursing in the first place. It's not always possible. You know, they're not always going to get better, but you can see improvements, you know, and to me that's everything. And if I can visit somebody and put a smile on their face, that's my job done for that day. If I've made their life easier or better, then that's enough for me. I still love nursing.
So,
all your medication up to date?
Up to date, Luke?
Yeah. Wonderful. Your prescription due? Is it?
No, not yet, no.
Okay.
No, I'll be another couple of weeks, I think, before it's due. Yeah.
Right. I'll go and do this.
That little bit of it, it's not much.
Right, okay, so we're going to do our group on communication skills and boundaries for neurodivergence, particularly in the eating disorder patient population.
Marvellous.
By the end of the session, I would hope that you guys can understand a little bit about how neurodivergence can impact your communication style and your communication needs. I love spending time with patients, I love chatting, I love doing activities with patients, I love just going for a walk with a patient, having a really informal chat. I love being with my colleagues. I love the human side of care, if that doesn't sound too cliche. Has anyone got anything they'd like to add? How about you online, Kaz? Do you find it difficult online?
Yeah, sometimes I do. I find myself I get distracted by like a noise outside and things like that.
I think, well, from a patient perspective, I mean, this is the beauty of daycare in the respect that we've got a multidisciplinary team all within one place and with such a breadth of knowledge. You know, you've obviously got consultants, dietitians, OTs, therapists, all within one area. So you can come to one place and you've got access to all that care.
And for me, I chose to go into this line of work because I had struggled with an eating disorder when I was younger, and I attended daycare, and it saved my life and actually set the trajectory of my entire career, because I went, I want to deal with that and I want to help people in that way. And here I am getting to do that.
You are living the dream. Get too distracted.
No, me either.
Amazing. Yeah, it's amazing, your brain.
What gets in my way are policies, procedures, duplication of tasks, sharing information in 5, 6, 7 different places when I can't for the life of me understand why that's necessary. Manual data handling, why? Manual analysis of data, things like that. As a staff nurse, you have to do, but in my role now in operations, I very much have to do it. If there's safeguarding involved, you have to share with the local authority, you have to share with the CQC, and it's the same piece of information via 4, 5, 6, 7 different portals. And not only is it time consuming, it's mind numbing. And especially if you're sharing it amongst so many people, that the chance of making a mistake within that data is massive as well.
Quite often I've found the technology ineffective, really. Quite often it's not fit for purpose. The fact that you have to remember multiple passwords, you have to change them passwords every few weeks. Then you have to remember all the new passwords that you've changed, and then trying to access them, you go on holiday, you come back, you try to access all these different accounts that you can't get into. So it takes you a full hour before you've even started to actually do your actual nursing duties, trying to get in touch with admin, trying to get in touch with IT to actually get you back on the systems. It has a massive, massive impact. Because like I say, it means that you can't do your actual nursing job. When nurses say these days, the majority of your time is spent documenting, they're right, it is. They deserve to have a nurse that can look after them. But when you're constantly having to log on to systems to document the same thing that you've documented time after time after time, and you just can't provide the care that they deserve.
Inputting the same data is probably one of the banes of my life. It's something that I wish I could, had a tool to bypass. For example, as a GP, you have one system for recording your documentation. You then have another system for all incoming post or correspondence from hospital, secondary care, wherever it might be. You then have a different system for x-rays and investigations, and then a separate system for bloods. So on your computer screen, you might have 7 or 8 tabs open, and you can imagine human error. Mistakes are going to happen because you can't find all of your information that you need for the one patient in one place.
Bureaucracy.
Yeah.
We've had that in our experience of trying to both chase down other healthcare providers or services or referrals, even through doing the right to choose process for ADHD, right? We were both like, we are working on this together and separately and checking that it's been done.
2 years it was.
Yeah.
From getting
so much
referred.
bureaucracy, right? For us both to have to chase and keep on top of it all the time.
And that's what I think that certainly for a patient, that's the exhausting part when you have to do that. That whole chain's interrupted, and it only takes one link, and actually somebody's care can be completely disrupted or even missed, and there can be tragic circumstances.
Yeah, when things are still being done in wider healthcare systems on a letters or emails even format, things that are really time sensitive don't get done. And there was a period of time where it was so inconsistent from getting results from the GP that Lindsay had her NHS health app and was just screenshotting me her blood results and sending them into me over WhatsApp.
And I do it now. So I do it now if I have it.
That's the best we could actually do. And then call the GP, and it was just the jankiest ways of having to find a workaround because it's really urgent stuff.
I don't particularly like living on my own. I don't like it. No, I don't think I ever will. I don't care what people say, that you get used to it. You don't. It's awful, especially when you're sat in all day and you don't see anybody all day.
What do you enjoy about Sam coming?
I just look forward, I'd probably miss her if she didn't come now, wouldn't I? She's been coming is it about 9 months?
Yeah, it is now, isn't it? Your confidence has definitely grown, particularly around your mobility and your walking and things, hasn't it?
Yeah.
And like I say, I still have to tell her off now and again for trying to do too much, don't I? The other week you were talking about standing on stools and cleaning pictures, weren't you?
Well, she hasn't got me that new stool yet.
Good.
I think she's forgotten.
Good, that's
She's
a good
forgotten.
thing. I don't want you standing on stools.
No. I know.
To have everything in one place would be amazing. To have something that's simple to navigate as well. Because some of the systems I've used in the past, you need a degree to navigate them. And when they have to do like a teaching session on how to use, and you still don't know what you're doing, when you've got so many systems that you have to access to, you'd have to look into a complaint, and then you'd have to access a system to look at a complaint, but then you would have to access another system to look at the policy around that particular complaint, and then you would have to access another system to document your findings, then you would have to access another one to find the notes, and it can just be so time consuming. As a registered manager with a CQC, you have certain CQC criteria that have to be met. Audits have to be done regularly. So having your information and your documentation easily accessible to do those audits and to get all that information together. It's so important because it can make the difference of it being half an hour job to it being a 2, 3, 4 day job.
Time is this commodity. We all struggle with that. The thing that interferes with that is a black hole that I carry around in my head most of the time. And in it sits this gremlin that I haven't given him a name yet, but he's driven by worry and fear about missing some piece of paperwork, missing some deadline that we were supposed to hand something in. It isn't really the clinical side of things, but it's the tick boxes, the checklists. If that process hasn't worked as it should, and then a patient is told, we're going to have to pause your treatment for 6 weeks until this is resolved. And how do we answer that? The paperwork wasn't processed, just not good enough at all.
Every 29 minutes, someone in a care facility stops caring to start recording data. And that recording creates approximately 18,250 data points per patient per year. Why? Because there is only one nightmare that can keep any care provider in this country awake at night: regulatory compliance. And this is not because of the regulator. It is certainly not because of the regulations. The regulations are great. They're here to serve, to protect, to uphold the dignity of those that rely on us, and to make the UK's care system a much better one than any other country. The problem, the impossible problem, is the process of evidencing compliance. Right now, to prove that you are compliant, you have to capture every action, every interaction, every note, every deviation, every single day, just to evidence that care happened. And that is more than overwhelming. That is humanly impossible. In fact, it is so impossible that even the regulator doesn't review all the data. Their methodology, as we all know, is to sample a sample of the data. And this problem, this impossible problem, persists only because we have been using the wrong tools. These were tools that were built for a completely different era, a bygone era. And when your tools aren't built for the job, I'm afraid even the best care teams will fail. The single assessment framework looks so simple, right? Every care facility in the UK is governed by just 5 domains: safe, effective, caring, responsive, and well-led. Also known in many circles as the 5 reasons your team hasn't had a lunch break since 2019. But it's actually not that simple, is it? Each domain breaks into subdomains spanning hundreds of evidence categories. Everything from incident logs, supervision notes, infection control, clinical audits, end-of-life planning, resident outcomes, nutrition tracking, HR compliance, and the list goes on and on and on. Hundreds of processes, thousands of data points, and they are all multiplying by the hour. For 100 patients, that's approximately 1.8 million data points a year. This isn't documentation. This is drowning your teams in admin. People are not burning out and leaving because they are not resilient. They are burnt out because the systems we have given them have put them underwater. Let's be clear about this. The care sector really does not have a data problem. We just keep adding integration after integration. What it has is a systems problem. People looked at the compliance problem and thought, this is impossible. So we're not going to solve it. Let's build a system to capture data instead. So that is all we have done over the last 20 years. We have not transformed care at all. Legacy systems were built simply to log your care, not to enable it. We didn't stop the flood. Let's be honest. All that we have achieved is that we digitized it. We've simply replaced pens with keyboards, folders with PDFs, paper with platform. But the flood, it still keeps coming. We were not interested in building a better digitized system. We said, let's make compliance run silently in the background. We aren't interested in trying to digitize evidence. Our focus is to make the evidence self-writing so you and your teams don't have to go scuba diving in floods of admin. And as for insights from the data, those are so integral to everything. They are core and the very foundation of what care should be built upon and improved on. But instead, all we have now is that they are provided as a bolt-on, an upgrade, and you get charged more for this. To us, that is clinically and operationally wrong, and more so, it is just morally wrong. It is now time for something totally different. It is time for a leapfrog product, not another update, not a smarter dashboard. It is time to pull the plug on this data flood. It is time for a new category, and we call it care intelligence. Care intelligence isn't a system. It is a real-time, AI-powered companion for every care team. It flows with your day. It thinks like your team. It sees what matters and it silences what doesn't. It doesn't ask you to track care. It tracks it for you. And what this means for you is countless of hours saved, stress reduced, and more importantly, human care restored. This isn't software. It is a fundamental shift on how care can be improved. Because we never set out to build a better product. We set out to build a better future.
Hi everyone, I'm Ruth and I run Health Connect. Let's pretend today that I'm a senior nurse at Rose Lodge Mental Health Hospital. To get rid of the need for using lots of different systems and duplicating data and potentially missing information, Health Connect has created one smart care platform. It brings everything together into one AI-powered care intelligence system. Let's look at how it works with the patient at the centre. Meet Robert. He's my patient, recently diagnosed with dementia. He suffers from chronic lower back pain and has been a long sufferer of asthma. On one screen, I have everything that I need to care for Robert. His daily notes, his legal status, care plans, risk management plans, investigations, physical assessments, incidents, and vitals. Everything is connected. So you put the data in once and it populates throughout the entire system. So you can use it again and again. Let's look at one prime example of how risk management and incident management are interlinked. Unfortunately, Robert's had a fall. I'm going to report the incident quickly. By speaking into the device to record the text, I save time and I'm recording the information on the go. This morning at 10:20 a.m, Robert was found on the floor of his bathroom. He said he slipped as he was going to wash his hands. He was found without his non-slip slippers and only wearing socks. He has a small cut on his elbow. Because the risk assessment is auto-connected to an incident, it prompts me to update the risk assessment and the management plan. So now I'm going to create a care plan for the wound that Robert incurred as a result of his fall. Now I can add care tasks within this care plan so my team can care for Robert with the information that they need. Together we can better collaborate and track the progress of care for Robert's wound. I know that my team is informed of all of the information that they need because of Health Connect. As a team, our most common task is recording daily notes, but in Health Connect, it's no common daily note. I can link it to the right care plans and risk assessments. Health Connect also automatically logs any vital sign readings that I take as daily notes. So no more scattered data or duplicated data, and this enables one magical feature, AI shift handovers. Now it's time for me to hand over Robert's care to Tanya, my night shift colleague. So I've generated a shift handover with Health Connect's AI. The AI daily note summary captures everything that happened over the last 12 hours or longer if I need to, from care plan updates to risk management plan updates, the incident, and any vital sign readings, of course. It saves me so much time rather than compiling all my notes and then writing out my shift handover right at the end of my busy day. And that's not all. That's just one example of how Health Connect flows with my care team's day, cutting out the unnecessary noise. With the patient at the centre, this interconnected data flow allows for one more thing. It'll be ready soon for all care providers using Health Connect. It's the solution to the impossible problem of compliance. Devon's going to take you through exactly how we'll do this.
Now, let's look at the way it can be done. Not just the way it can be done, but the way it needs to be done. One clean screen, real-time compliance, zero duplication, zero stress. What you will end up with is a live feed to show your real-time compliance across all 5 domains. Yes, real-time compliance. That means that you can generate risk scores across all of your domains, click automated assessments, and this is where you can have real insight into your compliance readiness. You'll be flagged with areas for improvement so that you don't have to guess. The analytics is done for you. And all of this is thanks to one living record. We have created a single source of truth that includes every aspect of care. Everything from your care planning, your daily records, your risk assessments, your management plans, your incident management, anything you can think of, the compliance AI has oversight across all aspects of care and will provide you with intelligence in real time. This is not just digitized. This is not just centralized. This is real intelligence. This is risks surfaced before they escalate. Compliance, handled behind the scenes in real time. Audits, accurate, effortless, and most importantly, instant. Remember those 1.8 million data points we spoke about? Dealt with instantaneously. And as impressive and as advanced as that is, it is not the most impressive part of what we've built. This is what is. An inspector calls. You open up your audit hub. One click, one single click, and your full CQC compliance report is there. For the first time in care history, compliance writes itself. This is a jailbreak. This is the moment that you have all been waiting for, and you have just been given the key. And that key is available to every care provider in the UK today.
Home visit, Sunday, 18th of May, 11 a.m. to 12 p.m. I like the fact with Health Connect that you can set myself little tasks every week. So rather than having to remember specific things for specific clients, when I log on for each client, I have a bar at the side where I can see all my tasks for the next visit. So it tells me, it gives me little prompts as to what I need to do on that particular visit. Did you hear it, Sandra? Good. Do you want to press your bracelet for me? Right, no. Yeah, please.
Your alert has been received.
Hi, good morning. It's Sam from Riverpath Care. And it's really helpful with things like checking smoke alarms or checking the lifeline bracelets and things like that. Things that you might not necessarily think of straight away when you get there because you're quite focused on looking after the client. Lifeline appears to be working. With Health Connect, that you can have like a where I am now and where I want to get to, so you can have those conversations with your clients. It's like a way of them looking into the future, you know, to say, well, I know that I'm walking with a Zimmer frame now, but in 6 months' time I'd like to be fully mobile again and be able to walk around the house without anything. And it's like sets that little goal, which we all like little goals to achieve, don't we? So things like that just kind of give you those little bit extras that I've never had before. There's not really been a system out there that's kind of giving you that little prompt and that little push of just have a think about this, do you need to do it? And it's such a help, it really is.
What I like about Health Connect is Health Connect enables me to amalgamate all of my clinical notes in one place and also allows me to collaborate with other members of the MDT and ascertain what they have, their perspective on the patient from that particular day, which is easy to view, easy to find, and easy for others to understand as well, which is often where things can get confused in other systems because information is sort of dotted around in various different places.
Health Connect is revolutionary, there's no other word for it. I can click a button and know if every single patient within my service has an in-date care plan, an in-date risk assessment, and whether they're effective. That's huge from a management perspective and a compliance perspective. I can go in and see if my care plan and my actions are relevant to my own policies. That just saves so much time. Health Connect does that for us. Not just the platform of Health Connect, but the team behind Health Connect understand healthcare. They're not a team of tech developers who think, I know best, I'm going to do this. Half of the team are clinicians themselves, and they understand the needs and they understand that you have to do things in a certain way.
Health Connect is one of the simplest systems that I've used, but it's got the most detail in. And you won't believe it until you see it. It's streamlined to the point where it gives you the information you didn't even know you wanted when you open it up. It's brilliant, and it does again mean that you can give patients more of your time.
For me, it's about quality. It's about providing that meaningful experience to somebody. With the systems that we have with Health Connect, it's about bringing that family together as well. Excuse me one second.
I think
Thank you for calling Riverpath Care. This is Kate. How may I help you? I don't know of any other system that allows families to see the real-time things that are happening with their loved one. It's about giving them peace of mind. And you look at other systems, it's like, yes, we gave mother a bath today. Yes, we gave mother a cup of tea. But it doesn't tell you what kind of day mom had. And it's not just that tick box exercise, it's that full narrative. For me, it was about getting the right type of technology, one that was moving things forward in healthcare. I want one system, not 5 or 7 different systems. I need something that's easy, takes the effort and the time away from doing the day-to-day tasks that are required to be done, where we can put the emphasis back on the care and back into that human element, that kindness, that compassion, that dignity for delivering care.
We need to give these healthcare professionals the resources, technology that they need to enable them to do the job effectively and ultimately provide a service that's effective and safe for patients as well.
We have a wonderful team and they do the best that they possibly can. And if life could be not just easier, but the ability to deliver higher quality care, which is what everybody in the team strives towards, if we can give them technology that facilitates that, no brainer. My message to fellow clinicians is you need Health Connect.
Hi everyone.
Hi, Tanya.
Hi Ruth. Hi everyone. Thank you so much for taking time out of your busy day to join our Health Connect Care Intelligence launch. And special thanks to the team at Abbey Clinic and Riverpath Care for being the stars of our documentary. And now is time for the equally exciting part of today's launch, Q&A, questions and answers. So you've seen the Health Connect Care Intelligence System. Devon and our care team community have shared the impossible problem of admin and compliance and how Health Connect is designed to solve it. The live comment section has been buzzing with amazing questions, so we can't wait to answer them really. So joining me, Dr. Devon Moodley, you've seen him, and our CEO and our COO, Ruth Kyle, and you've seen her on the presentation earlier as well. Amazing work, you both. Ruth, Devon, are you ready to answer the questions?
Yep.
Great, let's get started. So first question from Walter. Walter asks, how will this sit alongside current systems? And do providers know the data is safe? So 2 questions in one there. I'm guessing, Walter, what you mean current systems is in like other systems within the ecosystem. I'm going to let Devon and Ruth decide what that means. And Walter, if you want to know, if you want to elaborate more on that, it'd be great. So let's tackle the first one then. How will this sit alongside the current systems? Devon, if you'd like to go first, yeah.
Yeah, I'm presuming you're talking about other electronic recording systems. So the system itself is a complete system. It has everything that current care recording systems have, but it does have the ability to integrate and to pull data from other systems if we need to. Of course, it's about being very careful about who you choose to integrate the data from and how the data is structured. One of the biggest problems with utilizing artificial intelligence is how do you assess data that's in a structured format in order for the AI to provide you with insights. The majority of the systems, or rather a lot of the systems out there, the data is very unstructured, free text, so it's quite difficult. And those systems would need to conform to certain interoperability standards in order for them to be able to be interoperable and to integrate. Data safety, we have all of the necessary certifications and qualifications that are required for data protection and data storage in this country. So that's not a problem at all.
Amazing. So Ruth, do you have anything else to add, or are we good to move on?
No, let's keep going if there's more questions, yeah.
Yeah. So second question from K Juhan. Do patients need to agree to sharing data with AI plugin tool? She says, sorry, that might be a silly question. No question is silly, Kate.
That's a great question, actually. I think patients should be asked about sharing their data all the time. It doesn't happen, does it, though? That's the problem. And I think the data, who does the data belong to? Well, data is about the patient, and they should have much, much more of a say in terms of what happens with their data. The current system, so if you're in hospital care or if you've gone to a GP, your data is just recorded. And how that is then utilized and shared, well, it depends on the systems, and you don't generally have a choice in it. I, for one, believe that you should have absolute choice in terms of what happens with your data. From our perspective, in terms of, it's not a plug-in tool. So I should have started there, actually. It is a fully comprehensive ecosystem which utilizes the data that's put into the system. In terms of how the AI is trained, it's very, very, very specific. In order to ensure that there are no biases, and we've been working very, very hard on this part, because the majority of artificial intelligence systems, there are inherent biases in there. We have developed systems that will allow for the removal of biases. And in order for us to do that, we have anonymized data. So even on the system, the training takes place by the anonymization of data. So your personal data, your demographic data isn't going into the system in order to for it to be trained.
Amazing. And I must repeat myself, no question is a silly question. So feel free to ask. An amazing question and comment coming from Tim. Thank you, Tim. This has been an amazing update on a superb system. Way better than even tennis at Queen's. Well, thanks, Tim. So question from Tim. How easy is it to adapt the system to different parts of the care system, or does it not need that? So I think it's similar to kind of on the same similar line as Walter's question. But yeah.
I think the question in terms of the care system, so what you have is a very, very comprehensive ecosystem in any country. And that's everything from outpatient systems to inpatient systems. And the question is a very good question, because the systems are disparate. So what you have is you have specific niches, and that is one of the fundamental differences between this and other systems. The system is interoperable across all of the subsectors within healthcare. And it's not about adaptation to that has already been built in. It's beyond adaptation. It's looking at the nuances related to the specific processes of the individual providers within the subsectors. The subsectors are covered. That's been covered from the outset. And what we do in the first instance is we look at process mapping in order to ensure that we can maximize effectiveness and efficiencies within a particular subsector. So it is not just easy, I think it's vital, and that's one of the main differences. It covers all of the subsectors within the ecosystem.
That's great. A question from an anonymous viewer. Does the carer need a tablet or a laptop, or can it be accessed on a mobile phone? It's a really good question.
Yeah, shall I take this one? So at the moment, Health Connect is presented to you in a web browser, which means that you can use it on any device going. We're also, there's loads in our roadmap. So in our roadmap includes an app form, but at the moment you can use it on any browser Wi-Fi based device.
That's great. Very handy, isn't it? Next question from Michael Booth. Will the clients and patients be able to get access to the records? Could the family carer be able to update in real time?
Absolutely. I'll let you get through it. You can answer.
Yeah, it's a brilliant question, and it kind of ties back into this question, the question that Devon answered about who owns the data. So part of our journey is to put this data closer and closer and closer into the hands of the people who should own it, which is patients. And the first step along that journey is a patient portal where you can share real-time data with your patients, with their family members, with other people external to your organisation who are collaborating in their care. That is already built into Health Connect. We have that capability right now.
And I just draw your attention to the healthconnect.com website. So if you go there, you'll be able to see our full product suite. And one of the core products in our product suite is the patient portal, which is real-time, accessible by the patients and their family and loved ones. Question from Amanda. Could we also integrate other systems such as remote monitoring or for vital signs? And what would that look like?
Yes, that's already in place, and it's not just related to the person. There's also environmental devices, Amanda, that can be incorporated into it. So if you've got IoT devices, for example, they're easily integrated, and that's essential. It's not the way in which it's been done previously has been just data that you've typed in, and that's just one part of the data. We produce lots of data on our own these days, just picking up stuff off your mobile phone, for example. You've got data on there that's quite valuable. So it's both data from the person as well as environmental data, and all of that can be integrated. But more importantly than integrated, it's about the ability for the artificial intelligence to analyze that data and then provide intelligent insights.
A very, very philosophical yet an amazing, great question from Dina. I have been in this sector for 35 years across 4 continents, and every time someone says revolution, my frontline teams end up with more forms, more burnout. This looks like a leapfrog tech, but why should we believe this time will be different?
Should we both take that? Devon, you go first. I've got one.
You go first. I can see you wanting to jump in.
The reason why you should believe it's different is because we passionately care about 2 things simultaneously. One is that we provide advanced, forward-thinking technology that works exceptionally well, and we put the best possible technology in the hands of your carers. The other thing that we passionately care about is their change management journey and change management in your facility, and how you help your teams embrace the change is more than half of the job. And we have built a team of experts in business change management for exactly that reason. We're not about throwing over some technology to you over the fence and waving goodbye. This is about helping you get absolute value out of the technology that you purchased by helping your teams embrace it. They should be coming to you to say, we need more of this. This is wonderful. And we're passionate about that bit of it as well.
So to add to that, so I've been in the same rooms as you, Dana, where boards have made decisions on systems. The difference this time is it's not about changing software. It's about changing the entire system. It's about changing mindset. It's about changing how we work. And this isn't a new application. This isn't a bolt-on. This isn't an integration. This is completely new architecture. And you've seen for yourself real-time compliance, which is just the start of what we are doing. That's the first bit of what's coming through. And this is real insight, not oversight. And the main difference that you will find from utilizing the system is that it is built to serve the workers. It is built to serve those frontline staff that you've just spoken about, and it is not built to serve a legacy system. That's the difference.
Amazing. We're getting a lot of questions, so many questions, but I am very conscious of time as we're running out of time. But let's wrap up on a high. So we're getting a lot of questions from outside the UK, which is amazing. One of them says, UK is the first country. What are the timelines for the other countries? I mean, if you guys are so excited for Health Connect to roll out, let us know, contact us, let us know more. But Devon, Ruth, what are the timelines? Do we know? Can we share? If not,
I think we will be making some announcements in the next couple of months. maybe in the next couple of weeks. And I think let's wait for that. There was one question which I thought was really important, if I could answer before we wrap up, Tanya, and it was about family members. Is there going to be an opportunity and ability for them to view and input data? The answer is it's already there. That's already been built in, and it's beyond family members as well. So you can share with whoever you want to share. They will have the ability to input, and that will then allow for one living chronological record to be in place, because ultimately it's the patient who has to be at the center of it. That's what we've created.
I was going to wrap up on that note as well, because we're getting so many questions about patients, families, spouses, loved ones, collaborators. So we already have that infrastructure within our platform, and across all of the product suites, there collaboration, kind of collaborative features, such as like sending forms out to your loved ones to collaborate, fill in information about the patient, filling information about their hobbies and things like that, and through the patient portal. So everything can be accessed through the patient portal. So if you have more questions, our team is on hand to help. All you need to do is sign up through, there's two ways. You can search Health Connect Care Intelligence. We're kind of plastered across the first page of Google, or you can go to health-connect.com and fill in your detail in there, and our team will jump on the first chance to be able to talk to you, understand your unique challenges and needs, and tailor Health Connect to your needs. So thank you so much. Let me just wrap up quickly, and if you have more questions, feel free to get in touch. If you're sick of legacy tech, constantly repeating yourself, and ready for care intelligence, head over to healthconnect.com again. If someone can share the link, I will quickly share the link in the chat box. If not, it's on the screen right there. And you'll be able to get in touch with Ruth on the screen here, and Danny, our head of partnerships. Make sure to follow us on LinkedIn for more updates, product deep dives, and upcoming events. Thank you again, and we see you soon.